We've heard a lot here about different payment mechanisms. This is a pioneer project. How much political leeway have you got to look at different payment mechanisms as part of the primary care project?
I'm sure we've got the right people to answer that, being from Spain and America. And but let's log that question. We'll put that. We'll see, we might have some people who can answer that. I think the answer is you just go and get on with it and hope no one notices. That seems to be what many of the people. And you talk to monitors about it while you're doing it, probably. So, but we might ask Dennis that question.
Paul Thomas, GP in Ealing, West London. It's a kind of comment, really, that we're hearing complementary view images of what an integrated care system could look like. On the one hand, we're hearing that there's the sort of machine model that produces outcomes. On the other hand, we're hearing of the learning organisation model that helps people to be prepared. Now, it strikes me that these lead to completely different images of what we want. My view is that the second image about how you create the infrastructure to help people to help themselves is not being discussed enough, and we should be exploring that a bit more. So, is that your view? Question mark?
Okay. I don't have a view. I'm just chairing. Dennis, do you want to take that one on?
I see. My answer to your question is absolutely. That is my view. That the fundamental to keeping people healthier is you have to find ways to help people to help themselves. Measuring the outcomes will tell you, are you being successful in helping people to help themselves? I mean, you have to measure the outcomes. Just take the asthma kids. If they're still not using their flow meter and they're not changing their steroids at the right time and they're still getting into the hospital, we're not doing a good enough job educating them. That's where individualized, tailored education comes into place. And to do that, you need a learning organization mindset that you're learning from each other. Gosh, you know, my partner is getting better results than I am. What's that person doing? Interacting with the patients they're responsible for. I need to learn from that. So to me, they are all blended, not separated.
Dennis, can I just ask on that, because I think something that you didn't say, but I think it was a strong implication. You can't learn if you haven't got standardised processes because you can't measure anything.
Well,
right?
I did try to allude to that.
Yeah.
I completely agree with what you just said.
That's James, do you want to quickly come in on?
I think I completely agree. I think you need to take demand out of the system in that way, but you said it yourself. I mean, you do need an infrastructure to support people to do that. And I didn't talk about the personal health budgets and all the sort of incentivization at that individual level, but I mean, certainly there are messages there as well, I think, about how you achieve that.
Okay. Santiago, what does your group do to help patients manage their own care? Is that something that you invest money in?
Yeah. We actually do you remember the chronic plan. Well, we have a group of people on the top of the pyramid, the Kaiser pyramid, included in that specially managed group of people, and we have a health portal with some microsites specially dedicated to these people, and they can access all their individual information, and they can keep in contact with the organization, not the hospital, with the health area, with the nurse who is in charge of that particular patient, with the GP who is in charge of that particular patient, so they can connect and somehow interact with the organization through this one tool. But there are many other actions, like, you know, working with the schools, working with the community, with the public health system, with nursing homes. So it's a matter of getting all the stakeholders involved in delivering care.
So the same principle being worked out there. Somebody, yes, I can't see who it is. But,
David Wellborn from Cass Business School and with Matrix as well. Dennis, you mentioned the tendency to say, oh, there's a great model over there, let's copy that model and import it straight into an organisation. And you said that very disparagingly, that is futility. I totally agree with that. How do we overcome the perception that there is an absolute best model that is entirely packageable and liftable and shiftable between organisations?
I think one way to help overcome that is to relentlessly study the outcomes of the different groups, because the standard should be whatever is the best outcome today, whoever's getting the very best, and that may change. It may shift from place to place, because once you start standardizing against what the outcomes you want, then people will be able to accommodate to that and move in that direction by changing their own internal processes. And if they have to, they'll get in an airplane and fly over and study the processes that this other organization is following. And I'll just give you an example. In 1993, we ran a joint group, 12 academic institutions, analyzing the results of open heart surgery. We found, after looking at this in great detail, one surgeon out of 100 cardiac surgeons, 12 academic centers, had 0 stay in the ICU after open heart surgery. When we studied it further, is because he had no episodes of atrial fib afterwards, atrial fibrillation. Our surgeons all flew out there and operated with them. And they found that when the patient was coming off of the bypass, they were infusing, I think, magnesium sulfate or some kind of a solution nobody else was doing. And they asked him, why did he do that? He says, well, it blocks atrial fibrillation after surgery. Doesn't everybody know that? Never published, never talked about. But by studying the outcomes, all of a sudden one person stood out and people began to say, what are they doing? So relentlessly looking at outcomes and studying it really helps people to come to grips with the fact that we should be focusing on outcomes, change our processes as appropriate to get there.
I think, David, you're perhaps referring to the government and policy, how we persuade them not to do that. But I mean, because constant repetition of that failing doesn't seem to have discouraged them, does it? That's, I think, has been the...
Well, one way to encourage, this is what we do in Washington. I go to Washington. I said, look, we've been doing whatever we've been doing for the last 30 years, and we're here now. You want us to be in a different place, you got to change what you're doing. Yeah. And they say, well, how do we regulate that? And I say, you just missed the whole message. The message is, give us more freedom to do it, but hold our feet to the fire on our performance, our outcomes performance.
Any other hands up?
I wanted to say something.
Yeah.
I wanted to add something on top of that. When we speak of information systems and having the professionals involved and committed and knowing the outcomes, we might be making a mistake. We might be thinking only of doctors and nurses. And this shouldn't be the case. In our organization, we have cross-functional teams, and we have the financial guys, the logistic guys, the whatever, working together, trying to understand the whole process and the whole outcome, because everything is related to each other. Okay?
Okay. One last one, I think. Yes, sir.
Jazz Gill, Imperial College. It seems one of the key important factors in what people have been saying is the issue of incentive systems. And I mean, there's a classic paper from the 90s which is entitled Why People Hope for A whilst Rewarding B. Now, I'm at a loss to understand why is it that the Mayo Clinic, I'm not sure how it's funded, why is it it's able to focus on wellness and not something else, activity and so on and so forth in terms of maximizing, say, patient volumes and so on. So is there an answer to that paradox?
I think my best answer has 2 categories. One, it's a culture within Mayo Clinic that started 135 years ago. I don't know why it started, but that's just the way the Mayo brothers thought this is the way to do it. Focus on the patient and teamwork. All doctors are salaried. That's the way it started. That's the way it is today. And the second is we report our own results. When you walk into our hospital, when I was running the Jacksonville Hospital in Florida, we published every day a piece of paper that we put on each door of our hospital beds that showed the infection rate in that room. That got people's attention. It got the patient's attention, it got the family's attention, it got the nurse's attention, and the doctor's attention. We look at outcomes, and we shared them with each other. So it was a culture, it's not a financial incentive within Mayo, and therefore it can't necessarily be replicated everywhere else, but it's in a lot of places where people want to do very good, and if you show them their results, they're going to try to improve as we do it. So
Dennis,
it's that focus.
Because I think that what I actually took from a lot of your presentation, and indeed from Tony and some of the others, is that we can mess things up very well with incentives. We can encourage people in the right direction. But I think in both the examples from Spain and your example, the importance of leadership, vision, these other things actually, I think policymakers particularly, we get very hung up on incentives, but I'm not sure. They help, but there's a bit of a tendency to rely on them as the key instrument. And I think I've heard this morning there's quite a lot more to it. There's long-term, consistent effort, clear vision. I love the say things 8 times, engage the staff, square root of N, point out to people where they are with information, use some of that professionalism and internal competitiveness, and sort of consistent leadership over time, which seems to me to be at least as important as the can we design an incentive. And British policymakers seem to have this idea that if we can just get the cheese and the electricity right, the rats will run through the maze. And guess what? We're not that clever, and the rats are cleverer still. So we need to rely on more sophisticated and more multidimensional approaches, I think, will be the conclusion I take from what we've heard from 3 excellent presentations. Going to break for lunch. 2 o'clock? Yeah, let's say thank you very much. Thank you.